I'm Associate Professor Libby Callaway. I'm the Independent Living Stream Lead in the Rehabilitation, Ageing and Independent Living Research Centre at Monash University. Independent living to me means being able to do the things you want to do in the way that you want to do them and where you want to do them and when you want to do them. So a big focus in that is working out, what do I want my life to look like and what might be the ways that I achieve that. Part of that conversation could be around the supports that you may want to use, whether that's assistive technology supports, human supports, or built design that's going to work for you to do the things you want to do in your day.
A number of our rail research projects in the independent living stream tackle the really important task of co-designing our research methods with people themselves to capture evidence of independent living outcomes. I'm going to mention a couple. Our work with the Huntington's disease community found that successful independent living really needed coordinated services well beyond health, for example in housing, welfare and justice, and together with that community we built a set of 8 social impact domains and published those to guide service delivery. And our co-design work with the assistive technology community, particularly with people using prostheses due to amputation, powered wheelchair users and the deaf-blind community, found 6 areas in which it's really critical to evaluate independent living outcomes. The right assistive product can deliver outcomes in the areas of participation, cost effectiveness, can minimise the need for any other supports, can enable consumer empowerment and can improve satisfaction. And we're constructing the My Assistive Technology Outcomes framework to enable AT users themselves to fully document the outcomes of their assistive technology and to specify the supports that they need to live full and independent lives.
In addition to this project, I'm currently working on a joint research project with an industry partner, Scope, looking at the incidence of falls among people with intellectual disability living in specialist disability accommodation. This was a project that was identified by our industry partners in order to support independent residents. And people with intellectual disability generally have a higher falls risk when compared to others of a similar age. And so our team initially completed a systematic review over the last year, identifying possible assessments and interventions to reduce falls risks with this population. This has led to us to our current project, where we'll be asking staff at some of the Scope specialist disability accommodations to complete a modified falls risk assessment tool for each of their residents that have an intellectual disability. Our aim is to also gain feedback from the Scope staff regarding their perspectives of completing the tool and capturing the information regarding falls risk with clients with intellectual disability. And following this, we plan to pilot a falls risk intervention informed by the data that we collect through the Scope staff about the falls risk of their residents with intellectual disability.
As a health economist, I've been able to bring an extra dimension to some of the research underway in the independent living stream. And what this does is look at more than just those outcomes which are related to the individual themselves and the impact it has on society, but also the cost implications. And those cost implications are beyond just the cost of the intervention or the assistive technology which forms part of the intervention, but also looks at the cost impact on the individual and society. And so this includes things like employment, and it can look at the productivity and the gains that can be made through employment. It can consider other elements such as the utilisation of health services and support services, as well as the funding that supports those individuals. So by bringing health economics into the independent living stream, we're able to look at another dimension of the impact of the important work being undertaken.
Australia has been experiencing over the past few years unprecedented reforms to disability services, reforms to aged care services, and also to our healthcare. And as part of research within the Rehabilitation, Ageing and Independent Living Research Centre, the Independent Living Stream has been focusing on projects that can directly provide evidence that is converted into policy and practice for government, both at a federal and state level, as well as at our local regional level of government, but also for people who experience disability or other health conditions that will require them to be using independent living services, and for the providers of services in the independent living stream. As part of that focus, co-design is central to our work, and employing people with lived experience, collaborating with our community partners is vital to ensuring that the work we do in this stream is translated into both policy and practice in Australia and also has international relevance.